Now we have a GMA health alert. Some doctors say testosterone may help some women struggling through menopause, but isn't for everyone. It's a story we first saw in the New York Times, and our chief medical correspondent, Dr. Narula, is going to join us now and just really talk about how this has become a big conversation.
It's so interesting. And you know, Robin, we're finally at a point in this country on television where we're talking about women's health and hormones and menopause very openly. The problem is that the science really isn't there. We haven't invested in women's health research. But the reason this has become such a big part of the conversation is when you look at the fact that we only have right now 2 FDA-approved medications for low libido in premenopausal women, no FDA-approved medications for low libido in postmenopausal women, you can understand how there's real gap here and a void. And so step in social media and influencers and ads and longevity companies who are really seeing this gap and filling it with testosterone, which they are claiming can improve sexual libido, among other things, mood, energy, muscle and bone health, right? But it's important to note that right now in this country, there is no FDA-approved testosterone treatment or medication for women. The only countries that actually have that are Australia, the UK, South Africa, and New Zealand.
Okay, you mentioned science just a bit ago.
Yes.
So what does the science actually show?
So Robin, our testosterone levels sort of peak in our 20s and then begin to decline. So by our 50s, it's about half of what it was in our 20s. The data shows that there is some benefit for testosterone given to postmenopausal women with low libido, what we call hypoactive sexual desire disorder, in terms of improving their sexual arousal and responsiveness. We also see a little bit of that benefit in premenopausal women. Where we don't have the data is for all those other things, right? The mood, the energy, the muscle, the bone health. And we have to point out there are real risks and concerns here. First of all, we don't have any guidelines around dosing. Second of all, we have no long-term safety data beyond about 1 or 2 years. We've only studied testosterone in women who've taken it with estrogen. So what if you give testosterone without? What if younger women who are taking testosterone get pregnant? We know you shouldn't be taking it when you're pregnant. Testosterone is converted and broken down to estrogen. We talk a lot on this show about estrogen-fueled cancers. Could there be a longer-term risk with things like breast cancer or endometrial cancer? And then there are side effects, so things like acne, loss of hair on the head, hair growth on the face and body, weight gain, voice changes. So, you know, it's definitely not without concern or risk.
So if you're considering doing this, what should you know?
Definitely talk to your doctor about the risks and the benefits. Most of the major medical groups will recommend against pellets. These are these implanted pellets that give off testosterone for several months. The problem is you have no idea how much you're getting, and it sort of lasts with you for the whole time of that. Other women will use some creams and gels made at compounding pharmacies. Again, there's no regulation there for quality or safety. Other women will use off-label medication that's prescribed for men, but given to women at 1/10 the dose. But again, discuss it with your doctor. Have your testosterone levels checked throughout, as well as your lipid and liver function tests.
It's good that we're having this conversation.
Yes, really important.
Appreciate that. Thank you, Dr. Narula.